to quickly jump on and talk about a patient that I had yesterday. So she was a beautiful lady in her mid-60s and she came to me with prolapse type symptoms. So vaginal heaviness, bulge, and just that dragging feeling. Worse when she was sitting on the toilet, worse towards the end of the day. Not too bad when she first wakes up. And then worse with repetitive lifting. So this is a really common presentation for things like prolapse. So her symptoms started about 6 months ago, and she did mention that her third child, when she was born, she had a really large head circumference and had lots of tearing. So back then they didn't exactly specify what type of tear my client had, but she did say that it was quite significant. She had some prolapse-like symptoms at the time, like postpartum, maybe 12 or so months later. She couldn't quite remember, but then she was fine. So it's only until 6 months ago, which is what, 30 odd years later, her symptoms are coming back. This is something we see all the time, especially if you're someone who has had a vaginal birth and you've had some tearing, or you've had a long pushing phase, or a bigger baby, or intervention that wasn't planned, and you don't do your pelvic floor rehab afterwards. Then you might totally recover and feel fine, but decades down the track you might find symptoms come back. So this is just a PSA. If you have had a baby, if you're having a baby, then please go and see a pelvic floor physio, because we can prevent these things from happening long term. Yes, obviously short term as well. Around that time too, you'll go through things like perimenopause, and that can cause a lot of changes on your pelvic health as well. So we can plan for that, we can prepare for that. If you are perimenopausal right now, we can work on how to optimize your pelvic health. So that also definitely comes into play in this sort of demographic. We can prevent things like urinary incontinence, prolapse, and there is so much we can do to prevent you from getting all these symptoms. So the advice can be a lot more simple than you think. If you get it right early, you can make a huge difference. So this is my little tip for the day, is to make sure you book in, get yourself checked prenatally, so when you're pregnant, and also postpartum at 3 and 6 weeks postpartum. So book in, the link's in our bio, and we look forward to seeing you soon in clinic.